Hello, everyone. I'm Christine Johnson. Thank you, Nick, for having us here. And this is exciting to be, I think, between these two speakers because some of the themes that have emerged in Babette's talk about markets and the way people use that to have more access to fresh food will come up in kind of my talk. And then I'm excited about hearing from Debbie kind of the examples of the creative work that she's doing in Toronto and around in Canada and around the world, because New York City is always kind of looking for the next big idea to creatively address some of our issues with the food supply. So I'll start by saying that I've worked in New York City government. This is now my third administration, and I'm still learning about ways that the city interacts and influences the food sector. So the ones I mention are ones that I've been involved in or have seen happen, but I'm sure there's many other ways. And this has been a really nice time, I think, to step back and think about the public sector and how government affects it at the beginning of an administration, because there's a lot of opportunity now to think about what can we do in this new administration in creative ways to influence the food sector. And I think there's a lot of opportunities as we go through. So the first thing I'll say is that this administration is really focused on, and our health commissioner is focused on, inequity, really thinking about low-income communities and their access to fresh food, which is exciting, and I think something that we're interested in thinking about how we can expand that work. And then also just more community engagement. And I'll talk a little bit about kind of the place-based work we've been doing thus far and thinking about what else we could do to really change the context for food access in neighborhoods. So I think about four things as I was overall thinking about how government influences. One is, how does the government spend its money on food? So I'll talk about that first. And then how does government incentivize the purchase of fresh fruits and vegetables for people who are receiving money from the government? Third is, how do we work to change the context in neighborhoods to increase access to healthier food? And then fourth, what are the big infrastructure changes that kind of change the context in the long term as we think about food in the most holistic way across all city agencies? So the first is one that I've been really involved in, which is, how does the government spend money on food? There's 11 city agencies that purchase and serve food to New York City residents. And they serve food to many of our most vulnerable populations, or people at a vulnerable time in their lives. It includes school children, people that are hospitalized, people in correctional facilities, seniors, and the homeless. And this is really the government's opportunity to provide food that's nutritious, but also model healthier eating so that people are seeing low-fat milk, whole wheat, items, low sodium, for example, and potentially taking those habits to other parts of their lives. And then also to change the demand for food items. And I think this is something that I'll kind of try to reiterate as I go through, but I think that the more I work in the government food sector, I think about not just what we're serving or what people are accessing, but what that influences on the food supply further upstream in terms of thinking about the whole distribution system. And when you have a system like New York City, where there's a lot of food being purchased, we serve about 260 million meals and snacks each year from the food purchased by New York City government, so a little over 700,000 a day. So a huge amount of purchasing power that allows us to change kind of the availability and potentially the price of things like fruit canned in its own juice versus fruit canned in syrup. Particularly when you think about wholesale sizes, not retail sizes. It's really important as we start to think about lower sodium baked goods and other items. And so that's something that I think the government not only has a responsibility to be serving nutritious food, but thinking about that influence that it has in terms of the demand. The second piece is we have another city agency that signs up people for SNAP benefits. And in addition to receiving SNAP benefits, the health department for the last 10 years has been supporting a program to increase buying power for those SNAP recipients in markets. And those are what we call health bucks. And people, for every $5 a SNAP recipient spends at a farmer's market, they receive a $2 coupon that they can use on fresh produce at the market. And that's one of the ways we really expand the buying power of people who need access to fresh fruits and vegetables. But I think there's two other pieces to that. One is that that's allowed a lot of farmers markets to open up and be sustained in lower income neighborhoods. So in addition to really providing more access for SNAP recipients, it also sustains a market for the entire community, which I think is really important. The third piece is that it helps support the regional economy. We're putting more money into the hands of farmers who are then taking that money back to their farms. So it's a nice way to think about increasing access to healthier foods in a way that helps a lot of different communities and the regional economy in a way that's really holistic. The third piece is really thinking about the context for a neighborhood, because while the farmers market and nutrition education there is going to help a small group of people, it's really the overall context for when you go into the bodega, into a supermarket and the farmers market, changing that across a lot of different retail areas. And we work with a program called Shop Healthy in the Bronx and Brooklyn in neighborhoods that have low access to fresh fruits and vegetables and low consumption, to change the availability of fresh fruits and vegetables in bodegas, promote low-sodium canned goods, promote low-fat milk, change so that there's a healthy deli options, and start to change the social norms around healthy food in the whole community. And I think there's still a lot more work to be done and a lot of kind of research on how to really integrate that work into supermarkets and bodegas. But that's something we're really interested in and I think is an opportunity for the city to do more. The other piece is to use our historic health department function for licensing restaurants in new ways. We've always gone into restaurants and other food service establishments to inspect them, and that really comes out of our work from being concerned about infectious disease and the temperature, for example, that food is held at. But in the past 8 years, the health department has amended the health code to focus on ingredients of concern, so restricting trans fat, for example, but also providing more information to consumers, so like the calorie labeling amendment to the health code. And that's another opportunity for when we're in the 24,000 food service establishments in New York City to think about also the impact on chronic disease and diet-related nutrition in addition to infectious disease. The fourth piece is really the big infrastructure, and I think there's a lot of opportunity here because this is really the city agencies that historically have maybe not interacted with food a lot, but had the opportunity to. And I'll just call it two examples. One is housing. In New York City, we have a new housing development in the South Bronx. It's affordable housing. It has a 10,000 square foot greenhouse on the top, and there's a CSA for residents in addition to additional produce from the farm being sold to community members and to stores in the area. So that's taking an agency that has historically just been focused on providing another service to New York City residents and really integrating the food piece in a really strong way that changes the context for the neighborhood. The other piece is zoning, and that's what's a long-term way we can affect food availability and do it in a way that provides more access to fresh fruits and vegetables. And the way we've done that in New York City is our fresh financing, which actually provides financing for supermarkets in neighborhoods that historically have not had access to large-scale supermarkets. And in New York City, we have 18 supermarkets that have been approved for that financing and 6 that are built and open. So in thinking about this, one of the issues that I really thought about was that in a lot of these ways we're affecting children, particularly young children, in interacting with them in many ways. The government has that opportunity. And that's everything from breastfeeding, promoting breastfeeding in hospitals when children are first born, which is so important to encouraging that opportunity for kids to be breastfed, to nutrition education in early child care settings and settings like universal pre-kindergarten, to school meals, after-school programs, and summer meals. And we know that while there have been some small gains in terms of obesity in young children, children who are obese or overweight by age 5 are very likely to be obese or overweight as adults. So there's, I think, a real responsibility for government to be working in that early child care sector and thinking creatively about other ways to work with families to really change the context in the home, and also to integrate more local food and healthy fresh food purchasing. So as I'm wrapping up, the themes that emerge for me in thinking about this were, one, there's still more opportunities to think about fresh food access. I think health bucks, our nutrition education and farmers markets are really interesting ways to start to change the relative price of healthy foods, and I think there's more we can do, and I'm looking forward to hearing from Debbie about some of the creative work that's going on around the world. The second piece is that when we're doing this work, we're starting to change the food supply, and I think there's more we can do to think about how to work with distributors, to identify healthier options, to make it easier for all the retailers we're working with, the hospitals, other venues, how they can access healthier food, and we can start to change the demand in ways that are larger than just working individually with retailers. I think there's an opportunity here because we've worked with so many different sectors. And then the third piece is starting to think creatively about other city agencies like housing and planning, and how does food interact with them, and how can they positively influence the food sector. And across all of those areas, I think really a focus on children and early child care is crucial as we think about inequity and health. That's it.